Hello. The first day you walk into a hospital and you're no longer actually a medical student but you're a doctor takes a lot of getting used to, no matter how much you try and prepare for it. For me, I kept stumbling over my introductions. Hello, Mrs. Jones. My name's Jamie Barclay. I'm a final year medical... I'm a doctor. I am a doctor. I'm Dr. Barclay. I'm Dr. Jamie Barclay. Never mind. You experience an awful lot of firsts in that initial few months. First prescription, the first time you sign that prescription chart and it means something. For me, lactulose, 10 ml TDS. I still remember the glory of it, thinking, yes, I've made it as a doctor. You will have no doubt be given this book by some very well-meaning friends and family in that first few months after you qualify. Sometimes it's really funny because it's true. Sometimes it's not funny because it's true. I'm going to read you an excerpt from it. Now bear in mind this guy went off to pursue a career in comedy cynical songwriting, so don't take it too seriously, but this is a flavour of his first few months as an F1. During the day, the job was manageable, if mind-numbing and insanely time-consuming. You turn up every morning for the ward round where your whole team of doctors pootles past each of their patients. You trail behind like a hypnotised duckling, your head cocked to one side in a caring manner, noting down every pronouncement from your seniors. Book an MRI, refer to rheumatology, arrange an ECG. Then you spend the rest of your working day, plus generally a further unpaid 4 hours, completing these dozens or hundreds of tasks. Essentially, you're a glorified PA, not really what I'd trained so hard for, but whatever. The night shifts, on the other hand, made Dante look like Disney, an unrelenting nightmare that made me regret ever thinking my education was being underutilised. The SHO and registrar will be down in A&E reviewing and admitting patients, while you are up on the wards sailing the ship alone. A ship that's enormous, and it's on fire, and nobody's taught you how to sail. Now, if you have a look at this, some of my friends felt slightly down in the first few weeks of doing the job. It's about 2 weeks into the job if you look at the date. And it took me a few months to catch up, but after a while I had days where this felt the same for me as well. Felt like things were pretty hard. And what is it that makes it so hard as an F1? And it's not every day, but I think when you start, things can be challenging. When you're training at medical school, you're learning to be a doctor, you're learning those doctory skills, diagnosis, coming up with solutions and treatment plans for patients. Then you start administrating largely for a senior plan that you're not always that engaged with, so you don't necessarily always get the full insight into why are we doing this for this patient and what's the background, and that can be quite demoralising and quite confusing, particularly exacerbated if the plan is sort of a mumbled, half-whispered conversation on the other side of a bed during a ward round and then rushing on to the next bed, so none of that helps either. You might be in an unfamiliar environment, like a different hospital that you've been training in, or you just don't know where things are on the ward, in the hospital, where radiology is, and all of that can be quite overwhelming. What makes it easier, I think, is the knowledge that the admin does get better over time. You learn this stuff, you become better at it, you become slicker at it, and as that eases, you get more time, more bandwidth to be more clinically involved. So don't be disheartened, because you are a doctor, you've trained, you've got skills and knowledge, which I'll touch on a little bit more later on. But you will be able to use those, and you will have moments where it's as good as you wanted it to be. As you demonstrate your ability, you build trust. And when seniors give you trust, they give you more responsibility. And that's when you really get a chance to shine and to show what you can do and what you want to do. Keep asking questions, because even though you're not a student anymore, you're not supposed to know everything, and people won't think you're daft for asking questions. Poor communication is everywhere. All you can do is not be a part of it. If a consultant plan or a senior plan isn't clear, ask. You're not a psychic. You need to talk to nurses, because nurses are really important in the management of patients, and they can help make your life easier, and you can do the same for them. If you don't communicate what the doctor's plan is to the nursing team, then they'll get it wrong and it'll be handed over wrong, and this will just sort of escalate into more miscommunication. Notes and paperwork are the bane of your life. They're often illegible. If you can write legibly, that's a bonus. Take your time to write slower, so you write more legibly if you can. That's a bonus. if you can't read whether it says the patient has a problem with mastication or masturbation, that's going to lead to a huge difference in their treatment plan. So these things do matter. Other types of paperwork, such as death certificates, MRI scans, radiology, all that stuff, it comes to you. Basically, you're the gopher that has to take it off and deal with it. If you get organised, get hold of one of these little geek boxes or plastic storage boxes, that will help you enormously, and you can store other bits and pieces in there, from blood taking kit to who knows what. And ultimately, you probably want to be able to talk to your friends, because you're going to have tough days where you go home and you're going to feel pretty low, and you're going to want to talk to someone and go, do you know what, I had a really shit day today, and they're going to say, yeah, so did I, and you're going to go, oh, it was for exactly the same reasons. And those same people you're going to bounce off when you talk about the fun stuff you've done and the enjoyable stuff you've done as well. So it is all, it's not all bad. It swings and roundabouts. This is how I felt during and then after my first on-call. I think I was screaming solidly for about 20 seconds in the car on the way home. But it got better, and I got better at the job. So these things did improve. So what makes it amazing? Because it is amazing. You know, you just qualified, you become a doctor, and you had your graduation, and that was all good. And then it's like you're actually doing the job. So you've got skills and knowledge, and you're going to apply them. And you might get some knockbacks where you don't feel like you're able to initially, but you will. You will get this in spades. You will be able to apply them again and again. I'm going to tell you a short story about something that's a true story from an F1 that I know, and hopefully it emphasises a little bit of what I'm talking about. So the F1 was on a surgical firm, so he went into surgical on call, and one evening was asked to go down with an SHO to the paediatric ward to do an assessment of two 11 and 12-year-old girls to try and rule out whether they had appendicitis or not. So the SHO took one, and they said to the F1, off you go, try and be quick, don't spend too long on this, do a quick feel of the abdomen, and then take some bloods, and then they'll get an ultrasound scan. So it doesn't really matter what you do, because they're going to get investigated anyway. So that kind of irked the F1, who had spent a lot of time training to do a quite good job of these things. So he went along, didn't take enormous amounts of time, but did a thorough little mini history from the patient and from the parents, thorough physical assessment, listening to the heart, listening to the lung fields, and feeling the abdomen, and looked at the observations and had a quick scan through the notes. The observations showed this girl had systolic blood pressure of over 150 on more than one serial reading. And when he did the examination, he happened to detect a murmur, a heart murmur. Didn't know what type of murmur specifically, but just put these things together, and the parents had no knowledge of any previous heart murmurs. And suggested, when he wrote in the document in the notes, suggested, number one, unlikely any evidence of appendicitis. She was quite well and didn't actually have that much in the way of tummy pain, but bloods would be done and imaging would be done anyway. Number two, this girl has previously undiagnosed heart murmur and systolic blood pressure is high. Is there any chance she needs to be investigated for something like a coarctation of the aorta, for example? So documented this in notes, went back off with the SHO and went on their way. A few months later, when this F1 was going through quite a tough patch actually, it got a very heartening email from a consultant paediatrician, which I'm going to read to you now. Dear F1, I saw an 11-year-old girl recently in my cardiac clinic that had been reviewed by yourself regarding abdominal pain. You noted the fact that she was so hypertensive and that she had a heart murmur, and suggested coarctation of the aorta as part of your differential. She does indeed have a coarctation. This was not considered by our paediatric doctors at the time, and I just thought I should commend you, especially as an F1 doctor, for having correctly diagnosed this, or suggested this diagnosis. So I don't tell you that because we all go around like House making spot diagnoses of Churg-Strauss or sarcoid everywhere. We don't. But it does illustrate that if you do the good things well, if you do the basics well, and the simple things well, then you're going to do a good job for your patients. And you're going to pick up on stuff, not because you're a genius, but because you've bothered to just go through it methodically and try and sort of take a logical approach. And that is just generally the way to go, really, especially if you're in your first few years. What else made it amazing? Well, I mean, you do get to interact with patients in a special way that no other job in the world does. And sometimes you get to do things for people and make their lives better, not at all in a clinical way. So when I worked on an oncology ward, I had a lot of patients who I looked after on a daily basis, and they had terminal cancer. I could do nothing about their terminal cancer, but I could make them smile. I'd go in and tell a silly joke. I'd just go in and have a conversation with someone who's feeling lonely. One of my patients particularly enjoyed taking the piss out of doctors, so I gave him amazing ammunition for that. So I felt that I got a huge amount out of that placement in a clinical sense, but also in just being able to spend time with people and do something good for people who are in pain and who are suffering. Sometimes it's very clinical, so you might be the first on scene at an arrest. You often, when you're on call and you're thin on the ground, you might be having to make those decisions at that higher level. Start to make a management plan, start to put interventions in place before you get your senior support, because this patient's quite unwell. And that can be hugely satisfying when you see you've turned it around by putting an oxygen mask on, by giving some fluids, and having the confidence to say, this is what I've been trained and this is right. And you can do really great things with that. I think your friends and your colleagues, when you're working alongside, they can make it amazing as well. You'll go through your highs together and you'll go through your lows together. But this is like, this is the stuff of your memories. You'll remember this for a lifetime. Remember, it's just a job. And I don't mean to be demeaning about it. It's not just any job. It's obviously a fantastic job. It's a hard job. And it's pretty serious. It should be taken seriously. But when you're not working, go out there and do things to de-stress. Lifestyle for me is totally important. So this is an unashamed plug for North Wales and Bangor. If you want to come and work in a busy clinical hospital where 20 minutes after leaving your day of work you can go off to the beach, go swimming in the sea, go to a pub by the Menai Straits, the beautiful views, you can go rock climbing on some classic crags, go kayaking down rivers, go kayaking in the ocean. You do whatever you like, and it's all here. You can have the lifestyle and have the good job at the same time. Your mental health is phenomenally important, and for you to carry on doing this job, you need to look after yourself, and that involves the stuff I've just talked about, but also taking time to relax in whatever way you like, and taking time to be with people who are important to you. This last couple of years, I've had a friend who's had a life-changing injury, and it's made me really start to put stock of what's important to me. Family have gone in and out of hospital. I've had personal ups and downs, and it's really kept me grounded to say that I'm going to come in and do my best for my patients, but I've also got to do my best for me. Eat, sleep, take holidays, go and do cool things. And the best bit of advice I have for you is given to me by one of my colleagues in my F1 year. She just said, don't be too hard on yourself. I'm going to finish with a poem, with apologies to Rudyard Kipling, and this is called The Ode to the F1. If you can keep your head when all about you are losing theirs and blaming it on you, if you can trust yourself when others doubt you, but make allowance for their doubting too, if you can wait and not be tired by waiting, or being lied about, don't deal in lies, or being hated, don't give way to hating, and yet don't look good, nor talk too wise. If you can rewrite drug charts and not make them your master, if you can prescribe and not make prescriptions your aim, if you can meet with surgical triumph and medical disaster, and treat those two impostors just the same, if you can bear to hear the truth you've spoken, twisted by patience to make a trap for fools, or see the on-call vending machine broken, and stoop to get your crisps with worn-out tools. If you can make one heap of all your locum earnings, and risk it on one turn of pitch and putt, and lose and start again at your beginnings, and never breathe a word about your rut, if you can force your heart and nerve and sinew to serve your consultant long after they are gone, and so hold on when there is nothing in you except the will which says to them, hold on. If you can talk with crowds and keep your virtue, or walk with kings nor lose the common touch, if neither nurses nor orthopods can hurt you, if all patients count with you, but none too much, If you can meet the unforgiving radiologist with 60 seconds worth of perfectly reasonable indications for this CT scan, yours is the earth and everything that's in it. And, which is more, you'll be a house officer, my friend.